And now we turn to the coronavirus pandemic. Here in New York City, as many as 400,000 people returned to their jobs in some fashion as the city began its phase 1 of reopening for non-essential workers. New York Governor Andrew Cuomo, there you see him there, taking the 7 train to his Manhattan office today. Overall in the U.S., we are nearing 2 million confirmed cases of COVID-19, which is more than 20 times the number of reported cases in China, where the outbreak began. And there's new research about the origins of the virus that suggests that it might have first appeared in Wuhan, China, the initial epicenter, much earlier than we first thought. Our Tom Yamas has that story.
New evidence the coronavirus may have been sweeping through Wuhan long before Chinese health officials told the world they had a problem. These satellite photos, seen here for the first time, show various Wuhan hospitals on several days in October of 2019. The clues are all those red dots. They represent cars inside packed hospital parking lots 3 months before the Chinese government announced the spread of COVID-19.
When you start pulling these images together and you see a pattern emerge, the first thing you're thinking of, there's no way that this could be possible.
Dr. John Brownstein is the lead researcher of this new study from Boston Children's Hospital and Harvard Medical School. He specializes in disease surveillance. Using images from commercially available satellites, he and his team analyzed more than 300 photos of Wuhan hospitals.
Satellite photos, mirror images, October 2018, October 2019, and you see the number of cars skyrocket.
So much greater, and greater than any other sort of time period that we had looked at through multiple years.
This satellite image of Hubei Women and Children Hospital was taken in October of 2018 with 393 cars in the parking lot. A full year later, 714. At Wuhan's Tianyou Hospital, 171 cars in October of 2018, jumping to 285 in 2019. At Zhongyang Hospital, 506 to 640. And even Wuhan's smaller hospitals, like Tongji Medical Center, 112 cars in 2018 compared to 214 a year later, a 90% increase.
So more cars to a hospital, the hospital's busier, likely because maybe something's happening in the community, an infection is growing and people have to see a doctor.
Researchers say they can't prove this increased activity is due to COVID-19, but they did uncover another clue when they looked at Baidu, the Google equivalent in China.
You don't only have photos, you also looked into the internet searches of what was happening in October. What did you find?
What we found is people were searching for terms related to diarrhea, which we know now is an important symptom of COVID, as well as cough. And these things were starting to increase, late summer and early fall.
Brownstein tells ABC the study also considered potential outside factors unrelated to coronavirus that could impact this spike, like mass gatherings or natural disasters.
We looked through all of this. We couldn't identify any other reason for this signal.
ABC spoke with multiple infectious disease experts who told us there is almost always a delay in identifying and then reporting an outbreak. China has adamantly maintained they reported the outbreak in a timely fashion. But their own CDC director recently told Chinese local media the novel coronavirus had existed long before it was found at the wet market in Wuhan in late December.
Our thanks to Tom for that report. ABC News did reach out to the Chinese government to ask about the Harvard study. They had no response except to point us to a paper that was issued yesterday saying that the origin of the virus requires research and it must be based on facts and evidence. And that's exactly why we now have someone who can help us out with just that. Dr. John Brownstein, Harvard professor who headed this study and also an ABC News contributor. You just saw him a moment ago in Tom's report. Doctor, thanks so much for joining us tonight.
Of course, thank you.
So first off, how did you draw the correlation between the increase in traffic and possible earlier cases of the coronavirus?
Yeah, so this idea of using hospital parking lots is actually something we started years ago, where we looked at hospitals across Latin America and saw that we could actually predict the flu season just by how busy the hospitals were. So clearly there's a linkage between, an infection that's spreading and people rushing to the hospital. So we took that concept and brought it to Wuhan, where there's still this mystery about what was taking place in the fall. And here we saw hospitals getting busy, parking lots filling up, and that potentially points to some infectious disease that's spreading in the community.
I mean, it seems really smart, but some might say, well, when a big event is going on, more people are in town, that could cause a spike in hospital visits. So how were you able to eliminate possible external factors like the Wuhan military games that are held in the city?
Exactly. I mean, we had to really eliminate things like the Wuhan military games, where actually our images came well before that. So the increases were already taking place. We looked at natural disasters. We looked at other factors that could influence the signals that we saw, and sort of nothing was bubbling to the surface other than this potential infectious disease that was potentially spreading.
And your team mostly relied on those satellite images for this study, but you also uncovered some trends on social media. What did you find there?
Yeah, exactly. So, of course, we're going to really want to drill into the findings we saw in the parking lots. And as you said, think about what might be influencing them. So we will look to other sources of information to help corroborate this finding. And we use Baidu, which is essentially Google's internet search engine. And we look to see what people were typing on that search engine and symptoms specifically. And they started increasing in volume as of late summer. And diarrhea actually is a common symptom of COVID and is a really main symptom of many people across Wuhan who are presenting to emergency rooms.
And more generally on the topic of the pandemic, at least 20 states have seen a spike in COVID-19 cases as places start to reopen and thousands of people are gathering together at these protests. Do you expect that cases will continue to rise over the coming days and weeks? And also, what's your advice to anyone who may have protested in terms of COVID?
Yeah, I mean, listen, we're dealing with two important public health crises at the same time. And so as a public health professional, as a citizen, you have to encourage people to use their right to protest. At the same time, we want to encourage safe protesting, right? Mask wearing, social distancing where you can. And the expectation is as reopening, as people start mixing, regardless of the activities, we're going to start seeing rises in infection. We've been seeing that already. The result of Memorial Day weekend, we're already seeing increases in many states. And as people start to really congregate again as the summer activities, we're going to see spikes of cases. Now, how far that will go, we'll have to see. Clearly, we're still, as epidemiologists, expecting another big wave of infection.
And the Department of Health and Human Services announced just today that the U.S. supply of remdesivir will be completely exhausted by the end of this month. How big of a concern is that for people who are being treated for coronavirus or using the drug to treat other conditions?
Right. Clearly, we have stockpile issues. That is one antiviral that people are counting on. But, clearly, that isn't either a silver bullet either. We are still wanting that vaccine. We're still months off. And so the best sort of advice that we can give is to try to reduce transmission. And as tiring as that is, to encourage mask wearing and social distancing. Places that are seeing active transmission, they still have the opportunity to generate, cases that ultimately lead to deaths. And so the best thing now is to encourage people to try to prevent transmission that ultimately reduces your need for these antivirals in the first place.
Dr. John Brownstein, thank you so much for your insight as always.
Thank you, Lindsay.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.